Hey guys, welcome to Total Health Live with Dr. Sudano. I'm Dr. Nick Sudano, and thank you so much for joining us on this episode. And today I've got a topic that I believe that probably affects almost about 100% of us. So at one point in your life, many of you experience, like I have, anxiety. And so anxiety is something, whether the fear of things that are known or unknown, perceived, things that maybe have happened or have not even have happened yet. Many of us experience anxiety. So that's what this is going to be about today. So if you experience anxiety and maybe you don't even know what the real cause of it is, you're thinking to yourself, I don't even know what I'm anxious about, today's going to be a great episode for you. So whether you're a child or an adult, it affects both of us. In fact, many times children and adults might experience things like ADD or ADHD because of a hidden anxiety. And what we're going to talk about today is one of the hidden causes, because so many people may be aware of their obvious causes. They had a death in the family, they had a job loss, they had something that was traumatic that happened in your life. But many of us also experience anxiety where we don't even know where it's coming from. We're not sure. I could tell you when I first went away to school, I didn't even know what I was anxious about. I thought I was excited about leaving and going away and the experience of being away from home and so on. But there was anxieties that I didn't know about that were creating problems with me. So hopefully, once again, whether you're a child or an adult and you're struggling with anxiety, this is going to be a great seminar for you. Because I'll tell you, many of you are experiencing either, you're ashamed of it, your experience is either that it's affecting your job, your family, you're coming home and your wife doesn't know what's wrong, or your husband or significant other doesn't know what's wrong. So many of us are experiencing this, and sometimes it causes shame. You don't even know why you're experiencing the anxiety, but all you know is that it's gripping your life to the point where you're almost paralyzed, where you can't do certain things. And if that's you, to where you're experiencing anxiety and you don't even know where it's from or it's affecting your life, give me a thumbs up on that so I know that I'm on the right track with this. And guys, also too, it's causing you to lose things. It could be causing you to lose a marriage, lose a job, lose your family, lose friendships because of this anxiety that you don't even know where it's from. But not only that, we're going to talk about, once again, the hidden cause of it. Because a lot of you know what may be causing it, but some of you aren't aware of the hidden causes, and that's what we're going to get in today. And I know you've tried everything. You probably have had the PMA, the positive mental attitude. You've tried that. You've tried the meditation. You've tried the prayer. You've tried the exercise. You've tried going for walks. You've maybe even tried essential oils and, of course, drugs. And you're thinking, you know what, none of that's working for me. And by the way, a lot of those do work and they work well, but not for the hidden cause of anxiety. Unfortunately, it's not going to take care of what we're going to talk about today, which is a cause of anxiety that you're not even aware of. And that's basically how your brain chemistry works. So today we're going to get into a lot about how the brain works and these hidden causes that are outside of your control. So you're going to get a lot of experience today. So guys, we're going to go through some history of anxiety, but we're going to get then right into the solution. So you want to stay to the end so you can see exactly what we're going to be talking about, which is the solution to curing anxiety once and for all. Okay? So I'm going to turn my phone on because I want to make sure I see if there's anybody on. If you have any questions, guys, let me know. Let's see where the show is. Here it is. All right. Okay. All right. I could always count on my brother Sean to be on today. So Sean, thanks so much for being here. I appreciate you, brother. And thanks so much for your help the other day, too. We're going to be doing a lot of great work with toxicity. So guys, in the future, we're going to be talking about toxicity on our show and exactly what that can cause to destroy your health or cause health problems. So watch for upcoming episodes of that. So thank you, Sean, and thanks for the great comment. I appreciate that. You're always an inspiration. All right. Well, number one, the cause of anxiety or the state of anxiety is a state of apprehension or fear or anxiety, uncertainty in the known or unknown. It might not even be things that have happened yet. You might be fearful of things that haven't even, as I say, fear, false evidence appearing real. You might have anxiety about things that aren't even happening yet and may never happen, but you don't know why, but you're anxious about it. Or it may be things that you know are coming down the pike. So once again, guys, this is fear, anxiety, uncertainty, and an apprehension about things that are either real or not even real. Anxiety affects many, many Americans. In fact, it affects about 40 million of us. So according to the National Institute of Mental Health, anxiety disorders are the most common mental illness that affects all of or many Americans, 40 million of us, and it costs us about $42 billion a year. So this is a major, major problem. And then we look what people are choosing and using for this. They're going to drugs or maybe even alcohol to cope. And how many times does that just destroy people's lives? So that's why this seminar is so important, because we're going to be talking about practical solutions, things that you could be doing in a professional's office to be getting help if you don't want to go the drug route, if you don't want to go the medical route because of all the side effects. And guys, by the way, a major cause, and we're going to get into one of the biggest causes or biggest side effects of a lot of the medications you take today, could just shorten your life or end your life. So we're going to be talking about that. So there's many different types of anxiety, and you could experience any one of these. So anxiety disorders such as general anxiety disorder, or you may be OCD. You may have to have things perfectly placed. You may have anxiety because if the cans in your pantry are not lined up properly, if the hangers in your bedroom are not exactly spaced about a finger apart, and you know who I'm talking about if you're watching the show. There's people out there that do that. Or you could have panic disorders where you're just out of nowhere. Maybe something didn't just come up in your life. Maybe you didn't experience something that created an anxiety response, but yet for some reason you don't even know why, but all of a sudden you're in a full-blown panic attack for no unknown reason. You may have post-traumatic stress disorder or social anxiety disorder. So a lot of different things that we can see from this. Anxiety develops from many different causes. It could be a genetic issue. Your mom can have it, your dad can have it. You can think, well, it runs in my family, everybody in my family has it, and that may be the case. Or it could be personality. Once again, it's nature or nurture. Did you grow up in a lifestyle where maybe your mom was nervous all the time, and as a result it created anxiety in you? We see that all the time when my wife and I would be out to dinner with our kids, and we'd see other parents at other tables where their kids were just bouncing off the wall, and of course the parents were just all nervous about it and all anxious about it, and just a lot of tension you can feel. And next thing you know, the kids are just feeding off of that negative energy. So maybe you were exposed to a lot of negative energy in your household growing up as a kid. Or once again, that would go right into life events also. So you're exposed to things in your life that have created those mental records, as I say, to where you have this tape playing in your head of issues that happened many, many years ago that you're now bringing into the present. And it may be something that has nothing to do with what's going on in your life now, but you have this tape playing. And because of that tape, that recording, it's now affecting everything you do in life today. But one thing, as I said, we're going to talk about is one of the major causes, which is your brain chemistry, and we'll get to that in just a moment. But anxiety is also linked a lot to depression, and what they find is nearly half of those diagnosed with depression also suffer with anxiety. So here's the thing again, guys. You start to take an anxiety medication, which is then also linked to depression medication, so these antidepressants, and the side effects that we're going to get into are so extreme that you're going to want to know about it. So we're going to be getting to that in just a moment. Anxiety symptoms can be anything from, of course, panic attacks, chest pain, headaches, neck tension, but sometimes you might even get numbness and tingling. Some of these other ones are obviously, obvious things that you would see, but many times you wouldn't even think of a pulsing in the ear or burning skin. Could that be coming from an anxiety attack? What about things like electric shock feelings? Shortness of breath seems like an obvious one because you can't catch your breath when you're anxious. You have very shallow breathing. But who would have thought, inability to rest, heart palpitations, shooting pains in the face? You would have never have thought that. But many times these are caused by anxiety disorders, and these are anxiety symptoms. So many of you may have even got an improper diagnosis where you're experiencing anxiety, but yet you thought it was something else. You might have thought it was a heart problem, which, by the way, a lot of anxiety can create that type of symptomatology. And then, of course, you have your drugs of choice that you take. So if you haven't done everything else, like your positive mental attitude, your affirmations, your meditations, your exercises, your oils, and things like that, and I'm not trying to put any of those things down because they do help, you turn to drugs. And of course the drugs, they're a whole nother level of problem, because when you start to get into the drug issue here, now you're dealing with things that cause disastrous, even fatal side effects. So getting into some of these that you probably have never heard about. Whoops. You get into things like respiratory depression. Can you imagine that you start to take a drug and as a result it ends up causing your lungs to shut down? Or coma. I mean, you can go into a coma from these medications. Death, seizures, rapid heart rate, depression. So you're taking something that's trying to help you. Once again, if you have anxiety and depression linked together, you're taking something that's trying to help you to feel better. And it makes the problem worse. And we see this in things like with a Robin Williams, unfortunately. Someone on top of the world, you think he's got it all going on. He's got everything together, but yet he's got that hidden anxiety or depression inside, then takes medications that I believe cause them to do harm to himself. Now, I don't have proof of that, but I think that's a big part of it. When you look at these medications and you look at the side effects of it, you will start to see that they exacerbate the problems, and then the person a lot of times does harm to themselves. And then, of course, things like impaired coordination, and this is a big one here, guys and girls, libido changes. I mean, who doesn't want that? Nobody wants that problem. Cardiovascular collapse and bradycardia. But probably the biggest thing is the fact that these medications that we're taking for anxiety and depression all carry black box warning labels. And what that means, it's the highest warning that the FDA can give you, saying that they cause disastrous side effects. Things like suicide, homicidal thoughts, severe depression, so you can go into a deeper depression, psychological dependency, abuse, abnormal behavior, psychotropic, psychotic episodes, and withdrawal. And as I said, guys, the biggest problems we see with these types of medications is the fact that they cause suicide or homicide. Big, big problems. You're either going to hurt yourself or hurt other people, and we see this time and time again. So this is a big reason why you guys need to be careful when it comes to taking these types of medications for anxiety and depression. All right. Sorry, I'm just reading some of the notes here. I agree, Sean. I agree. This message needs to get out to a lot more people. So I appreciate you, brother, because I know every time we do a show, you share it. And guys, if you're watching this show, whether it be live right now or later on, do yourself and other people a great service by sharing it, because there's so many people right now who maybe are suicidal or maybe are anxious as a result. They're thinking about hurting themselves and you don't even know it. You know that you think this person on the outside has it all together, but meanwhile they're a ticking time bomb inside. I could tell you this happened to one of my friends. In fact, also my my brother's wife's cousin committed suicide doing things like this, where they just did harm because they didn't know that there was another way out. So let's get into this. Whoops. So how do we break free of this? How do we break free of anxiety? And pretty good graphics, huh? What do you think, Sean? Good stuff, huh? Well, let's look at the common treatments that we typically do. Well, we want the positive mental attitude. We talked about that in the beginning. We typically will do exercise. We might even get into yoga or meditation, the way you're trying to clear your head, and I get it. All these things are great. They will reduce anxiety, except for the big hidden cause that we're talking about. And once again, essential oils, and then you can come and try the medications. But what is the hidden cause? What is that one thing that the medications will not work on? What's the one thing that the oils will not work on, or the positive mental attitude, or saying all the great affirmations that you could think of? There's that one thing that will not change when we're applying all these treatments, these common treatments. So like I said, they work in a portion of the cases, but there's some of them that it will not work on, and that's the one we're really going to focus on today, and that is how your brain waves are working. The big key component to this is, do you have normal brainwave activity? And as I said, this is the hidden component that nobody talks about and nobody tests for. This is something that we test for in our office, so that way we can determine the proper course of treatment for this, so that way we're not just throwing things at you like oils, or recommending meditation or yoga, exercise, which, like I said, works really well, but not in this case. So let's look at brainwave activity. There's 4 main brain waves as to how your brain works. The slowest brain waves are things like delta. Delta, your brain is working at a very slow frequency. Consider it like first gear in your car. So in your car, you have first gear, second gear, third, and fourth, okay? So in these gears, actually we'll go this way so it makes sense to you guys. So in first gear, your car tows, your car can go up and down hills, it goes in snow, it pulls heavy cargo, it pulls heavy loads. So first gear for the brain is when you're asleep. So your brain literally goes down into about 1 to 3 hertz, and at this frequency, you're in deep sleep. Well, just out of that, we see something called theta. And theta is about 3 to 7 hertz or 4 to 8 hertz, depending on the author. And at theta, this is when you're coming in and out of sleep. You're just starting to go into sleep, you're just starting to come out of sleep, but you're not awake yet. So at this frequency, your brain is either waking or dozing. At the next frequency, that's alpha. I like to say alpha is kind of like you're chilling out. You're just relaxing. You're able to enjoy soft music. You're sitting there listening. You kind of zone out a little bit. Or maybe you experience this. I could tell you I have. You're coming home from work. You're coming home from somewhere. And you get home into your driveway and you pull in and you don't remember how you got there, right? If you guys can relate to that, give me a thumbs up on that. If you zone out the whole time, but it's not dangerous. You're aware of the road. You're watching the road, but you just fade off into somewhere else. And now you're in another, la-la land, we could say. That's alpha. You're chilling out. You zone out. In beta, that's your fastest speed, and hopefully you guys are using that right now as you're listening to this presentation, to where your brain is working as quickly as possible to process the information. So that is beta, and that is when you're attentive or alert. So when your brain is working properly, it should be able to move from one speed to the other. It should be able to go up and down, depending on the appropriate needs. So if your brain is in a study mode where you need to be learning, you're in a lecture, you're in a seminar, you're in a business meeting, and you need to be alert, you need to be in beta. If it's time to go to sleep, you need to transition down into delta. If your body's just relaxing, kind of chilling out, you need to be in alpha speed. So our brain should be able to transition from speed to speed very effectively. The problem results in is when we are not able to transition from one to the other. We get stuck in a speed that's inappropriate for what we're trying to do at that time. So for example, you're trying to go to sleep at night and you're still stuck in beta. Well, many of you experience that. You can't turn your brain off. For some reason, no matter what you do, you cannot turn your brain off. You try meditation, you try oils, you try positive affirmations, but you cannot get your brain to shut down a little bit so you can go to sleep. And so you experience what? Insomnia. So guys, if that's you, give me a thumbs up for that, because that is called brainwave dysregulation, meaning your brain is not in the proper frequency when it's supposed to be. Now, what if you have someone who's actually in a classroom setting, in a lecture, on the, in a workshop, in a business meeting, and instead of being in beta, they're stuck down here in alpha or theta. They're zoned out. When a child or an adult is stuck in that speed, when they're supposed to be ramped up to this speed, well, then you're suffering with ADD or ADHD. And so that's a whole nother problem. So brainwave dysregulation is when your brain is not functioning in the right frequency at the right time. So research demonstrates that normal brainwave patterns may become disrupted, or as we say dysregulated, causing neurological symptoms. So guys, because the brain is the master computer of your body, it controls everything that goes on in your body, all functions, all breathing, all cellular functions, from heart rate to respiration to glandular secretions, everything. The brain has to be able to be in the proper frequency at the proper time for everything to work the way it does. If it's not, if it's disrupted or dysregulated, it ends up causing neurological problems, which end up looking like symptoms that you may experience in your everyday life. We find then, let me turn my phone back on here, sorry. We find then that what happens is when the brain, and research has shown over the past 40 years, that abnormal brainwave activity is at the core of many child and adulthood disorders. And what we find is this: disrupted brainwave patterns, like I said, create a whole variety of symptoms. So if you're stuck in delta theta, and if you have abnormal brainwave activities there, it can cause impulsivity, socially inappropriate, hyperactive, distracted, disorganized, and of course your classic ADD, ADHD. Now, If you're stuck or you have dysregulation in alpha, you can have victim mentality. You can have depression. You can have avoidance behaviors. You can have, withdrawal symptoms. You can have agitation or passive aggressiveness. So guys, if you're experiencing anything like that, you may be having alpha dysregulation. And guys, over here, if we see this, where someone has maybe anxiety, worry, panic attacks, hypervigilant, you're obsessive, you're restless, you don't like change, you can't go to sleep at night. I could easily put insomnia in this category too. If you're struggling with anything like this, then what happens is you have beta dysregulation. So what we see is any one of these patterns, anywhere where you have dysregulation, whether it be the delta theta frequencies, whether it be alpha, or whether it be actually in beta, dysregulation or disappropriate frequencies or disorganized frequencies, kind of like the brain is shorting out, causes you to have symptomatology. And once again, guys, you may have tried everything. You may have tried meditation, prayer, positive mental attitude, oils, anything, and it's not getting you well. It's because you have brainwave dysregulation. So this is a hidden cause that you need to think about and address this very differently. And there's a way we're going to show you how we do this that will help you. The first thing you need to know, because obviously, as we said here, your brain is the most complicated computer on planet Earth, and I was explaining this to patients just last night. Your brain knows how to control and coordinate the function of 75 to 100 trillion cells in your body every second of the day. So because of that, it makes it the world's greatest